Question 1. A parent brings their 3-year-old daughter to the pediatric clinic with a fever and cough. While assessing the child, the nurse notes that the girl's genitals are swollen and bruised. The girl also tells the nurse that it hurts to walk. Which nursing intervention is most important? C. Notify authorities about suspected child abuse. The nurse is legally obligated to report all suspected child abuse. All 50 states mandate that suspected child abuse be reported. Documentation of findings, including the child's comment, is also important but not the priority. Although the appointment was for a different reason, the nurse must report the case. Signs of sexual abuse in children 0 to 5 years of age include the following: 1. Pain, itching, bleeding, swelling, or bruises in or around the genital area. 2. Difficulty walking or sitting, caused by genital or anal pain. 3. Urinary tract infections. 4. Reluctance to undress or insistence on wearing multiple pairs of underpants. Question 2. A child who is newly diagnosed with attention deficit hyperactivity disorder, ADHD, will likely display which of the following? B. Constant movement and squirming. Constant movement and squirming are indications of ADHD. Other signs include being unable to pay attention to directions or details, talking all the time, even when inappropriate, and being easily distracted. Somatic complaints and running away are indicative of emotional distress. Question 3. After a client learns that they sustained a C7 spinal cord injury due to trauma, the client tells the nurse, "I wish I were dead. I'm useless to everyone." What is the nurse's most therapeutic response? B. You are feeling a sense of hopelessness now. The nurse should reflect the client's feelings, so the client can continue to talk about their situation. Restating the client's words is a validation technique. The other statements are non-therapeutic. They shut off the client's feelings, offer a quick solution, or turn the conversation back to the nurse. A C7 spinal cord injury will result in quadriplegia, paralysis of the arms, trunk, and legs. However, because the C7 segment is farther down the cervical region of the spinal cord, the majority of arm functions will remain intact.
Question 4. The healthcare provider, HCP, has prescribed haloperidol for a client with Tourette's syndrome. When the nurse educates the client about possible side effects, including tardive dyskinesia, TD, which statement is accurate? C. The risk of developing tardive dyskinesia increases over time. Haloperidol is an antipsychotic drug that decreases excitement in the brain. Haldol is used to treat psychotic disorders like schizophrenia, to control motor and verbal tics, as in Tourette's syndrome, and to treat severe behavior problems in children. Long-term use of certain antipsychotic medications puts the client at a higher risk of developing tardive dyskinesia, TD. TD causes repetitive, involuntary movements, such as grimacing, eye blinking, and spastic movements of the tongue, lips, jaw, and limbs. Stopping or tapering drugs that may be contributing to involuntary repetitive movements can help. About 30% of clients taking antipsychotic drugs will develop TD. Antipsychotic drugs that can cause tardive dyskinesia include haloperidol, Haldol, flufenazine, prolixin, risperidone, Risperdal, and olanzapine, Zyprexa. 2 drugs that were approved by the FDA in 2019 to treat tardive dyskinesia are deutetrabenazine, Austedo, and valbenazine, Ingrezza.
Question 5. The nurse is working in the emergency department, ED, when friends bring in a client who attempted suicide by taking an overdose of an unknown medication. What is the first question the nurse should ask the client? A. What is the name of the medication? The first thing to do is determine what drug the client took. Medications have different antidotes, so finding the specific drug is important. Naloxone can be administered for suspected opioid overdose. When given to clients who have not taken opioids, there is usually no harm done. Once the client is stable, psychological help can be obtained. Question 6. During the cognitive assessment portion of their Medicare annual wellness visit, a client is asked to spell world backwards. When the client is unable to respond, what is the nurse's best action? C. Proceed to another task in the cognitive assessment. The Medicare annual wellness visit is a review of a client's physical health, functional ability, depression, and cognitive abilities. Staff uses simple screening tools to assess geriatric clients. During the cognitive portion, clients are asked to perform several tasks, including spelling a word backwards. If a client is unable to perform a task, the nurse should document it and continue. Do not assume the client is illiterate or that they have cognitive deficiencies. The Alzheimer's Disease Assessment Scale is a detailed test that requires a trained interviewer, and is not indicated here. Question 7. Following surgery with several complications, a client has developed paralytic ileus. The provider has prescribed insertion of a nasogastric tube, NGT, to suction. As the nurse prepares to insert the NGT, the client says, "Is this really necessary? I just don't think I can handle any more." Which of the following is the nurse's best response? A. You're discouraged about your recovery. Paralytic ileus is obstruction of the intestine caused by and NBSB, paralysis and NBSB, of the intestinal muscles. And NBSB, insertion of a nasogastric tube with suctioning, called nasogastric decompression, removes air and materials that could cause vomiting and aspiration. The nurse should use empathy to restate the client's emotions and help explore the person's frustrations. The other statements are not therapeutic, they show defensiveness, disapproval, and the nurse's wish to get the task done. Question 8. A mother has given birth to an infant with Down syndrome and a congenital heart defect. The nurse recognizes that the mother will need to process which emotion before successfully bonding with her newborn. B. Grief. After the birth of a child with a birth defect or syndrome, parents will grieve for the loss of the baby they hoped for and the life they were anticipating. Then they can begin to bond with their baby. Each of the other 3 choices is part of the grief process. Question 9. A hospice nurse is caring for a male client with cancer. He has acute bone pain related to metastases. The best way to assess the client's level of pain is to B. Ask the client to rate his pain on a scale from 1 to 10. Only the client can report on his level of pain. It is a subjective perception that should not be judged or dismissed. For managing his care and pain relief, asking him to rate his pain on a scale from 1 to 10 should be the guide. Question 10. After the provider leaves a male client's room, the client tells the oncology nurse that he was just informed that his cancer is terminal. Which of the following responses by the nurse is most therapeutic? B. I'm so sorry. Do you feel like talking more about this? When clients learn that their condition is terminal, they will likely be in a state of shock and denial. The nurse should offer such a client the chance to express what they are thinking and feeling. The nurse shouldn't offer false hope, distract from the moment by placing blame on the provider, or patronize the client by giving a stereotypical response. Question 11. A 28-year-old male is admitted with a diagnosis of paranoid schizophrenia. His care provider prescribes flufenazine 10 mg TID. After 9 days, the client remains unkempt and refuses to get out of bed. The nurse knows that flufenazine. B. Is most effective with the positive symptoms of schizophrenia. Flufenazine is a phenothiazine used to treat schizophrenia. It is most effective with positive symptoms, such as hallucinations, delusions, and racing thoughts. However, this client is displaying some negative symptoms. Other negative symptoms include apathy, lack of emotion, and non-existent social functioning. The drug takes effect in 3 to 7 days when administered for positive symptoms. Increasing the dosage or continuing the drug for negative symptoms is not effective. Depression is a common side effect. Question 12. A male patient tells his nurse that the CIA is monitoring and recording every movement, and microphones have been planted in the walls of the unit. Which response by the nurse would be the most therapeutic? C. This must seem frightening to you, but I believe you are safe here. Delusions are common in schizophrenic patients. The patient absolutely believes the delusion is true, in spite of any evidence to the contrary. Acknowledge the patient's feelings and offer support, but do not contradict. Doing so could lead to a lack of trust by the patient. Waiting to talk about the beliefs only reinforces the delusion. Isolation increases fear and anxiety. Question 13. A male patient with a diagnosis of panic disorder suddenly begins to cry and hyperventilate while yelling, "This is terrible. Nothing is right." What is the first therapeutic action to take? A. Lead the patient through a breathing exercise. A patient with a panic disorder can have sudden attacks of fear and anxiety, which include physical symptoms such as tachycardia, sweating, and rapid breathing. Hyperventilation can lead to respiratory alkalosis, which can increase anxiety. Help the patient perform deep breathing, which is calming and restores normal respirations. Medications such as diazepam or lorazepam are useful but not the priority. After the patient has improved, other interventions may be appropriate. Question 14. When a healthcare provider is interviewing the parents of an injured 6-month-old baby, which of the following is the strongest indicator that child abuse may have occurred? B. The injury isn't consistent with the baby's age. A child's injuries should be consistent with its developmental age. If not, child abuse is a possibility. The parents may tell different stories because of their differing perspectives. Child abuse occurs in every socioeconomic group. Stress and anxiety can lead to demanding or angry behavior. Question 15. Conversion disorder is a mental condition that occurs when a client has a physical problem that can't be explained by medical evaluation. What defense mechanism is associated with conversion disorder? B. Repression. The correct answer is repression, a defense mechanism characterized by inhibiting or forgetting thoughts that the client does not want to acknowledge. Conversion disorder is a mental condition in which a person has blindness, paralysis, or other nervous system, neurologic, symptoms that cannot be explained by medical evaluation. Conversion disorder is typically caused by extreme and NBSB, stress, emotional trauma, or depression. It's the body's response to a perceived threat. The physical symptoms develop as a way to try and resolve or relieve the source of the mental and NBSB, stress. Rationalization is controversial behaviors or feelings that are justified and explained in a seemingly rational or logical manner to avoid the true explanation. Projection occurs when individuals attribute characteristics they find unacceptable in themselves to another person. Sublimation is a positive defense mechanism that happens when people choose to redirect strong emotions or feelings into an object or activity that is appropriate and safe. Question 16. A client with a terminal illness and their family ask the nurse the difference between palliative care and hospice care. Which of the following statements by the nurse is correct? B. Palliative care enhances life at all stages of illness. Palliative care is specialized medical care for people living with a serious illness, such as cancer or heart failure. Besides receiving treatment for their symptoms, the client can choose to continue curative treatments for their condition. The goal is to enhance the client's quality of life for them and their family. It can begin at any stage of illness, including at diagnosis. Hospice is meant for clients at the end of their life. The goal is to provide care, comfort, and quality of life for the client who understands their illness will not be cured. Generally, hospice is provided for a client who has 6 months or less to live. To state that palliative care is better is subjective. Palliative care includes the final months of life, but is not time-limited. Question 17. A client who is experiencing paranoid delusions is admitted to the inpatient mental health unit. Which of the following is a therapeutic intervention for the nurse to include in the care plan? C. Initiate interactions with a few staff members. Delusions are false fixed beliefs that are out of touch with reality. Paranoid delusions, also called delusions of persecution, reflect profound fear and anxiety along with the loss of the ability to tell what's real and what's not real. The primary intervention is to develop a relationship with the client based on empathy and trust. Other interventions include the following. 1. Validate any part of the delusion that is real. For example, you could say, "Yes, there was a doctor at the nurse's desk, but I didn't hear him talking about you." 2. Ask the client to talk about the delusions and ask the following questions. Who is trying to hurt you? Can you think of a reason? How might this happen? 3. Don't expect that rational thinking will have an effect on the client's delusions. If you debate the delusion, the client may expand the details to counter your argument or include you in the delusion. 4. Don't take the client's accusations personally even if they are directed at you. Question 18. A patient is admitted to the medical unit after experiencing chest pain. Which of these additional findings would support a diagnosis of cocaine abuse? C. Perforated nasal septum. Cocaine is a central nervous system stimulant, able to increase heart rate and blood pressure. Because of vasoconstriction, long-term intranasal use of cocaine is associated with a perforated nasal septum and loss of the sense of smell. Reduced blood flow can also lead to gangrenous bowels and chronic diarrhea. Jaundice is related to impaired liver function. If present, it is usually due to viral hepatitis or concurrent alcohol use. Question 19. A patient is abusive to others and insensitive to their feelings, and the patient shows no remorse. Which is the most likely personality disorder? B. Antisocial. A patient with an antisocial personality disorder will display a lack of regard for rules, safety, and others. The patient will lie and act impulsively. A narcissistic personality disorder is demonstrated by airs of grandiosity and a constant need for admiration from others. A patient with a paranoid personality disorder exhibits distrust and interprets others' actions as threatening. A histrionic personality disorder includes excessive displays of emotion and attention-seeking behavior. Question 20. A couple seeks counseling after 17 years of marriage. The wife complains of nearly constant verbal abuse. The husband states that he behaves that way because his wife is a terrible cook and doesn't dress the way he thinks she should. Which defense mechanism is the husband using? C. Rationalization. Rationalization is falsifying an experience by giving a rational explanation. The client is attempting to justify his behavior by giving an explanation. Repression is blocking a desire from conscious expression. The client is conscious of his desires. Regression is returning to an earlier form of expression or behavior. Reaction formation is acting out the opposite of true feelings. Question 21. While reviewing the medical record of a patient diagnosed with Alzheimer's disease, AD, the healthcare provider notes that the patient is aphasic. Which behavior supports this finding? A. Unable to speak. Aphasia is the inability to understand or express speech. It can also affect reading and writing. It's caused by damage to the language center of the brain, which is usually on the left side. In Alzheimer's disease, aphasia is just one component of the brain's deterioration. Question 22. Adult children of an elderly parent seek information about the best way to help their parent transition from home to an assisted living facility. Which of the following suggestions will be most helpful for this family? B. Take the parent on tours of several facilities and have a meal there. The adult children should include their parent in planning for the transition. By doing internet research or taking tours, the parent can still have a sense of control. By taking tours and having a meal or joining an activity, the parent can get a sense of what it would be like to live there. If possible, the process should not be rushed, so the parent has time to come to terms with the move, as well as consider how their health may change in coming years. The entire family should have open discussions about the transition, including the parent as much as possible. Involving the HCP is not appropriate. Labeling clothing is premature. Question 23. The pediatric nurse is preparing to start a preoperative peripheral for in a 13-year-old girl. The girl seems anxious and tells the nurse that she doesn't understand why she needs this for. Which of the following statement by the nurse is most therapeutic? C. This will add fluids to your bloodstream. The nurse should always give a client honest information that is appropriate for the person's developmental level. Telling the girl why the for is necessary is the appropriate response. The other statements are neither honest nor therapeutic. They dismiss both the client's question and the client's feelings. Question 24. The healthcare provider is counseling a patient who was diagnosed with depression. Which of the following statements made by the patient should the healthcare provider recognize as a sign of transference? C. It's amazing how much you remind me of my favorite teacher. Transference occurs when a patient directs feelings and attributes from a person or situation in the past to a person or situation in the present. Transference is an unconscious response that may create a therapeutic impasse in the patient-healthcare provider relationship if it is not handled properly by the counselor. The other responses are examples of rationalization, which occurs when the patient attempts to create an acceptable explanation for unacceptable behavior. Question 25. The nurse is assigned to a client with a delusional disorder who has been refusing to eat. The client tells the nurse that their food is being poisoned. What is the most therapeutic way for the nurse to encourage the client to eat? A. Ask the client open-ended questions. The nurse should ask the client open-ended questions about why the client feels their food is being poisoned, then allow the client time to think before responding. Offer support and empathy. Do not argue facts, because it may cause the client to shut down. A delusion is something that a client believes to be true, even when strong evidence suggests that it is false. A client can't tell what's real from what's imagined. A client may believe that someone is planning to harm them, control their thoughts, chasing or poisoning them. Providing information ignores the client's paranoia. Offering to eat the same food shows support for their delusion. Do not try to reason. Question 26. After receiving the shift report, the nurse enters the room of a 92-year-old male diagnosed with a cognitive impairment disorder. The nurse asks him what day it is and where he is now in order to assess for. B. Orientation. Orientation of time, place, and person is the most appropriate way to do an initial assessment of a client with a cognitive impairment disorder. Question 27. The family of a client in the ICU is anxious and worried about the client's condition. How can the nurse best support the family? B. Provide flexibility in visiting the client. The nurse can best support the family by allowing family members to visit as they wish and need. This also supports the client. Offering coffee or telling them to leave the client does not provide support. Asking a chaplain to stay with the family is unrealistic. Question 28. When a client with a diagnosis of bipolar disorder is in the manic phase, which occupational therapy activity is most appropriate? B. Day hiking through the forest. During a manic phase, clients have high levels of energy, so physical activity, such as hiking, biking, or a sport, is appropriate. Activities that are competitive, such as card games, are not recommended. During the manic phase, focusing and concentration are difficult, so learning a new hobby or solving puzzles are not ideal activities. Question 29. Parents often experience high levels of anxiety before their child's surgical procedure. All of the following interventions can help reduce parental anxiety except A. Providing a certificate for a restaurant meal during the hospitalization. Studies show that about 75% of parents experience preoperative anxiety before their child's surgical procedure. Parental anxiety can affect their child. Including parents in as many aspects of their child's surgery as possible increases their knowledge of the procedure and confidence in the care of their child. Other interventions include classes, printed material, videos, and music therapy. Providing an activity that deliberately takes parents away from their child is not a therapeutic solution. Question 30. The nurse is changing the first dressing change of a client who had a bilateral mastectomy. As the nurse proceeds, the client says, "I can't bear to look at that." What is the nurse's most therapeutic response? A. It's okay to look away until you feel ready. Acceptance about altered self-image takes time. The nurse can ask the client if they want to be part of a dressing change, but should not force or rush them before they are ready. The other options are condescending or coercive. Question 31. A 22-year-old mother from Mexico arrives at the emergency department with her 3-month-old daughter, who has a temperature of 100.6 degrees Fahrenheit 38.1 degrees Celsius and signs of sepsis. The ED physician orders a lumbar puncture, but the mother is hesitant to consent until her husband arrives. What should the ED nurse do? B. Keep trying to contact the husband. In Mexican and other Hispanic cultures, the male is head of the household and makes major decisions. The nurse should keep trying to reach the baby's father. Symptoms of sepsis in newborns and young babies include poor feeding, vomiting, fever, above 100.4 degrees Fahrenheit 38 degrees Celsius rectally, or sometimes low temperatures, pale skin, cool extremities, and irritability. Question 32. The nurse approaches a client with a diagnosis of depression who seems withdrawn and anxious. Which of the following statements by the nurse is most appropriate? B. You put on a different sweater today. If a client seems withdrawn or silent, the nurse should use a simple, non-threatening observation. Avoid direct questions that can raise the client's anxiety level or that require a complicated response from the client's perspective. Question 33. When a patient presents to the emergency department with a toxic acetaminophen, Tylenol, level, what drug should the nurse expect to administer? B. Acetylcysteine, mucomyst. Acetylcysteine, mucomyst, is administered to convert toxic metabolites to non-toxic. Deferoxamine mesylate, desferal, is the antidote for iron intoxication. Flumazenol, romazepam, is the antidote for the sedative effect of benzodiazepines. Alzheimer, Chamet, is the antidote for lead poisoning. Question 34. A patient diagnosed with generalized anxiety disorder, GAD, reports ongoing nausea and abdominal bloating. A physical examination fails to confirm a medical illness to explain these symptoms. The healthcare provider suspects these findings are a result of which of the following? D. Somatization. Somatization, also known as somatic symptom disorder, SSD, is a form of mental illness that causes physical symptoms, including pain. Somatization is a means of coping with psychosocial distress by developing physical symptoms. Soma equals body. The physical symptoms that this patient is experiencing are caused by anxiety. The symptoms may or may not be explained by a known medical condition, but they cause unusual levels of distress for the patient. Dysthymia is a persistent depressive disorder that may occur together with anxiety and somatization. Derealization is a sense of detachment from reality. Dissociation is impaired awareness of one's body, self, or environment, and may include derealization. Question 35. Emergency medical personnel bring an unconscious patient to the emergency department. The patient's pupils are pinpoint, and respirations are depressed. Intoxication of which of the following drugs could contribute to these clinical signs? D. Methadone. Actions of opioids include constriction of pupils, secondary to parasympathetic stimulation, and depression of respirations, secondary to decreased respiratory center responsiveness to carbon dioxide. The other three drugs are stimulants, which cause pupil dilation, excitability, and increased heart rate and blood pressure. Question 36. Which of the following occupations carries the least risk of developing sensory alterations? D. Restaurant server. Of these four choices, a server is least likely to develop a sensory alteration, although there is a risk of musculoskeletal injury. Welders risk visual alterations. A disc jockey can develop hearing deficits. A carpenter can develop repetitive strain injuries and peripheral neuropathy. Question 37. A client with a terminal illness tells the nurse, "I wish my family would stop talking about a cure and that I'm going to get better. They make me so angry. I'm dying, and I know it." What is the nurse's best response? D. You're angry because they still hope you'll be cured. The nurse should use reflection to validate the client's anger with their family and encourage the client to continue to express their feelings. Experiencing anger allows for a connection. It allows for something to hold on to after being overwhelmed with shock and denial. Anger may be directed at the thing or person that was lost, the doctors, friends, family, God, etc. Under the anger is the individual's pain. Discussions with the family may be appropriate after the client recognizes their own anger. Telling the client not to be angry or to blame the family are not therapeutic responses. Question 38. A patient with Alzheimer's disease picks up her toothbrush and tries to brush her hair with it. This behavior is known as D. Apraxia. Ideational apraxia is the inability to use objects appropriately. Agnosia is loss of sensory comprehension, anomia is an inability to find words, and aphasia is an inability to speak or understand. Question 39. While the nurse is giving a client a bed bath, the client begins to cry. Which of the following nursing interventions is most appropriate? D. Pause the bath, cover the client, and sit with the person. If a client cries, the nurse should stay with the client and let them know that they can cry without fear of being judged. Acknowledge the tears and ask the client if they want to talk about their thoughts or feelings. Continuing the bath ignores the client. Stopping the bath and leaving the room makes the client feel alone. Documenting that the client is depressed is not appropriate. Question 40. The wife of a client with multiple sclerosis, MS, confides in the nurse that because of his ataxia, uncoordinated movements, her husband takes up to an hour to get dressed every morning. The wife asks the nurse for advice. What is the nurse's best response? D. Let him take as long as he needs. Ataxia is the lack of voluntary coordination of muscle movements. In multiple sclerosis, MS, this is manifested as clumsiness, unsteady gait, impaired eye and limb movements, and speech problems. In some cases, the lack of coordination is seen as tremors. The goal of MS care is to preserve independence as long as possible. It's best to let the client dress himself, let him know he can ask for assistance at any time. MS is unpredictable and can vary from day to day. The wife should be encouraged to adapt to her husband's changing needs, while letting him do as much for himself as he can. Question 41. A patient who was diagnosed with depression is prescribed fluoxetine, Prozac. Which of the following is the most likely adverse effect of this medication? D. Decreased libido. Fluoxetine is a selective serotonin reuptake inhibitor, SSRI. Fluoxetine increases the synaptic concentration of serotonin in the central nervous system, and it may also have effects on other nervous system functions. Sexual dysfunction is one of the most common adverse effects of SSRIs in both men and women, although the mechanism is not yet well understood. Other side effects include insomnia, cold symptoms, stuffy nose, sneezing, or sore throat, and GI symptoms, dry mouth, nausea, upset stomach, or constipation. Question 42. A female patient who is at high risk for suicide requires close supervision. To best ensure the patient's safety, the priority is to D. Check the patient frequently but at different intervals. By checking the patient frequently but at different time intervals, the patient will be unable to change her behavior. Reminding her of her past suicide attempts may actually motivate her to try again. Promising complete confidence is never appropriate. Decreased communication or silence can be a warning signal that the patient has decided to attempt suicide. Question 43. The nurse who works in the newborn nursery is caring for a neonate after an uncomplicated birth. After observing the infant, the nurse reviews the maternal record and notes that the mother admitted to drinking alcohol use during pregnancy. Which of the following observations by the nurse is consistent with fetal alcohol spectrum disorder, FASD? D. Smooth skin between nose and upper lip. Fetal alcohol spectrum disorder, FASD, is a range of problems that result from maternal drinking during pregnancy. The most severe is fetal alcohol syndrome, FAS, with facial abnormalities, growth and nervous system disorders, as well as learning and mental disabilities. Physical features with FAS include small eyes, an exceptionally thin upper lip, short upturned nose, and a smooth surface between the nose and upper lip _philtrum. Joints, limbs, and fingers may be deformed. Growth is slow before and after birth, with a small head circumference. There can be heart, kidney, and bone defects. A single palmar crease and low-set ears, with or without an abnormal shape, are associated with Down syndrome. Large eyes with hyperactive pupils is incorrect. Question 44. A patient is admitted to an inpatient psychiatric unit because of their plan to commit suicide by taking an overdose of medication. When a healthcare provider administers medications to this patient, which of these interventions is the priority? D. Make sure that the patient is not cheeking the medications. A patient who has suicidal ideation, especially by overdosing on medications, should be monitored for cheeking. Cheeking means hiding the medication in the mouth with the intention of hoarding it, so it can be used in another suicide attempt. Question 45. After an uneventful pregnancy, the mother delivers an infant who is soon diagnosed with Down syndrome. When the nurse brings the infant to the parents, the mother's partner tells the nurse, "The doctors here don't know anything. We're taking our baby to a specialist who will fix everything." What is the nurse's best response? D. I can see that this diagnosis is very hard for you. I'm wondering how much you know about Down syndrome. The parents are grieving the loss of a perfect baby. The nurse should support the parents and allow them to express their feelings. Assessing how much the parents know can help the nurse determine needs. Down syndrome is a genetic disorder caused when abnormal cell division results in extra genetic material from chromosome 21. Down syndrome causes a distinct facial appearance, intellectual disability, developmental delays, and may be associated with thyroid or heart disease. The other responses are inappropriate, dismissive, and rude.